Welcome to Coronavirus Positives, an opportunity to focus on some of the good news stories surfacing despite severe acute respiratory syndrome coronavirus 2, or as I would prefer to call it, Kong flu, given its oriental origins. Firstly, things will improve. Hong Kong and Taiwan were able to tackle the virus thanks to their experience with SARS, and other countries have learned from them. Singapore managed to contain the spread of the virus by acting quickly. Meanwhile, in Hubei province, where Wuhan is situated, the last 2 of 16 makeshift hospitals closed 3 weeks ago. The province reported no new cases for the 6th consecutive day on Sunday. Businesses and factories are reopening. Secondly, don't forget, people can get better. In fact, older people especially. A 103-year-old grandmother in Wuhan, China, made a full recovery from COVID-19 after 6 days. She had no underlying health conditions, according to her doctor, apart from mild bronchitis. I'm not really sure how that figures, but come on, she's 103. An 102-year-old woman recovered from the virus in Italy. Meanwhile, there are those in our own hospitals in the UK who are elderly and recovering. Now, whilst COVID-19 will take lives, most people do recover in percentage terms. Other coronaviruses are more deadly. SARS, 11% death rate. MERS, 34%. However, the death rate for COVID-19 is just 1%. To turn it on its head, 99% of people infected with the virus will recover. The challenge, of course, is that COVID-19 is highly infectious. So just remember, stay 6 foot apart rather than ending up 6 foot under. Now, good news on the ventilation front. University College London and Mercedes F1 have combined their efforts to make breathing aids for coronavirus patients, and these reduce the pressure on the need for ventilators. It took them less than a week, and they're already in some of London's hospitals. Self-isolation is indeed one of the most powerful weapons we have for the disease. On average, each person who has the virus infects 2.3 others. But if you imagine a chain reaction, stopping the virus from jumping from one person to another can have a profound impact. On the volunteer front, when the UK government called for volunteers to form a 250,000 strong group of community responders, they got them within 16 hours. What's more, less than a week later they had to pause the recruitment process because over 750,000 applications came through. On the hunt for a cure, or testing kits, or vaccines, or new treatment regimes, or whatever you want to look for, the good news is that there is no shortage of work going into different ways of preventing, detecting and treating COVID-19. In fact, about 35 companies and academic institutions are working to create a vaccine, at least 4 of which look promising. A slightly different angle, a researcher, Marshall Burke from Stanford University, has calculated that the reduction in emissions in China in January and February could save as many as 77,000 lives. Now, that's not much comfort if you've lost a loved one, but to put that number into context, that's more than 20 times the number of people who died from coronavirus during that same period. And let's not forget the irony that the further we are driven apart, the closer we seem to come together. The more we seem to invest in building stronger ties with our families and friends. In fact, it would seem that the human spirit cannot easily be crushed. I note that a jogger has managed to run a half marathon whilst in self-isolation. Sam Hustler, aged 27, completed the 13-mile trek by taking on 5,000 laps of his 10-foot balcony and his flat. Okay, it's not really good news, but it is funny. But just think for a moment about how NHS staff have been applauded in supermarkets, of how people have asked to pay the bill of paramedics whilst they're shopping, and of how children have heard happy birthday sung by their entire street. So, coronavirus positives? It's not all bad news.